When it comes to liposuction, not all surgeons are the same. Liposuction is a sculpting process much more than it is suctioning, and there are vast differences in the results that are created by different surgeons. This includes how complete an area is treated as well as how smooth the surface is, and also how nicely the area blends and flows into the rest of the body. What I'd like to talk about today is some of the unique things that we do at Artlipo when sculpting the thighs. The thighs, as commonly treated by most surgeons, usually includes the bulge of the outer thigh known as the saddlebag, and the bulge of the inner thigh, which is the area that women complain about rubbing together when they walk. Although both of these areas are common in my practice, there's really so much more that most women are not aware of that can be treated. Number one is full thighs. Not many surgeons perform a sculpting of the thigh from the top all the way down to the knee, but this is going to give the entire leg a slimmer shape as well as a smoother contour. My goal is also to create a continuous smooth line down the inner leg, which will make the legs look longer. Often there are multiple contour changes all the way down, so it can be rather complex. And this is not something that a less experienced surgeon does because it's a very advanced surgery. Number two are the knees. Most patients aren't aware that the inner knee has a fat bulge that can be treated. The inner knee bulge causes our eyes to stop there, and it's the opposite of the tapered look that full legs should have to look their best. Removing this knee bulge is a very straightforward procedure and creates a significant cosmetic improvement for such a small area. Number three is all other bulges. There's so many other irregular bulges that women get on their thighs that don't fit a particular pattern, but the principles of smoothing is still the same and almost any bulge can be improved. What sets me apart from other surgeons is that I'm an expert after practicing only liposuction for the last 8 years, and I'm an artist, which makes me a bit of a perfectionist. What I see most other surgeons doing is debulking and making areas smaller, but it takes a true expert to see irregular bulges with complex shapes and to be able to precisely sculpt these areas flat while blending to the edges of the bulge smoothly into all the surrounding areas. On the thighs, there are often a lot of subtle irregularities, many different complex shapes. So I take each patient individually and I carefully map out the area so that no matter what the irregularity is, we can usually improve or get rid of it. And the goal is to achieve a smoother, more beautiful line of the legs in addition to slimming them. Most doctors don't take the time or have the skill to fully visualize the line they're trying to create. It's my arts background that really helps me to visualize the way that I do. If there's something that we can help you with, please call us and schedule a consultation and evaluation. You'll see me personally. We have lots of great before and after photos on our website, in addition to many other informative videos.